It's the Pain Exam Podcast with your host, David Rosenblum, MD. If you treat pain or have an interest in pain management, join us as we discuss painful disorders, alternative treatments, practice management, and more. Be sure to subscribe to the Pain Exam newsletter at painexam.com and review the podcast on Stitcher or iTunes. Our high-yield premium episodes are now available on the Pain Exam app with a premium subscription, or access for free with a CME subscription at painexam.com. And now, without further ado, here's your host, Dr. Rosenblum.
Welcome back to the Pain Exam Podcast. I am coming back from Pain Week. I had a great time discussing PRP, regenerative medicine, and ultrasound guidance. I'm doing a few courses this year in New York in October and December. Go to nrappain.org for more information. In addition, we have the NYSIP, or New York, New Jersey Pain Congress in November in New York, which is going to be great. Sudhir puts that on. Sudhir Diwan, he's, if you don't know him, he's a leader in the field, and he puts on probably one of the best state-run pain conferences in the country. Probably the largest, and it's a great time, so try to make it there. Additionally, I am doing ultrasound IV access courses. Me and my associates are training people in New York, as well as ultrasound guided regional anesthesia and pain management. If you can't make it to the dates, we do private training, so just reach out to us, as well as shadowing. So this topic today is exploring bone marrow aspirate versus Adipose-Derived Stem Cells, intra-articular injections, therapeutic efficacy in knee osteoarthritis, and they're correlating it to the mesenchymal stem cell cellularity. It's an exploratory comparative pilot study, and I'll have the link in the show notes. Now, basically, this is, I have this age-old question whether to do BMAC or PRP. Generally, we do PRP first because it's cheaper and less invasive. But does BMAC really work better? I think it's controversial. It really depends on the study. In this one particular study, and this is just one of many that I'm examining, they're looking at osteoarthritis, and it's pretty much a fact that PRP helps osteoarthritis, so does BMAC and stem cells. The question is, what's best, and how do we stratify what to give to what patient? And the objective of this study was to compare the therapeutic efficacy of a single BMAC and adipose-derived stem cell injection into the knee for patients with osteoarthritis. They focused on mesenchymal stem cell quantity, quality, and in the harvested tissue. And they looked at the hematologic studies, analyzed, quantified the CD3/4 cells in adipose and bone marrow samples. 60 patients diagnosed with symptomatic degenerative knee osteoarthritis were enrolled. Patients under 50 received BMAC injections, while those over 50 received adipose-derived stem cell injections. Follow-ups were conducted at baseline, 1 month, 3 months, 6 months, using the VAS, WOMAC, Kellgren, Lawrence classifications, and range of motion. Bone marrow and adipose samples were harvested and processed to quantify viable MSCs. Mononuclear cells were isolated using density gradient centrifugation, and CD3/4 cells were subsequently enriched through magnetic separation using column-based processing. Cultured MSCs were counted weekly to evaluate proliferation. Both groups, not surprisingly, showed clinically significant improvements in VAS, WOMAC, and range of motion scores, p less than 0.10. There was no statistically significant correlation observed between the MSC quantity and treatment efficacy. MSC cultures succeeded in 32 aspirates, 30 from bone marrow and 2 from adipose tissues, with cell counts over 0.35 times 10 to the fifth. So they concluded at 6 months, both the BMAC and adipose-derived stem cell treatments resulted in significant clinical improvements, with a p less than 0.1, with no significant difference between the groups, with a p over 0.1. Findings indicate that that bone marrow samples generally yielded higher MSC counts and showed slightly faster recovery rates among BMAC-treated patients, but with no substantial differences at 6-month mark. MSC efficacy may depend on factors beyond cell quantity. Further studies need to be performed. Now, there's really a lot of studies out there that go over BMAC versus PRP. Some of them do show differences, some of them don't. I'm trying to explore this and understand it better for myself as well as for my patients and you all, because this is possibly a very viable therapy. This is a very, very viable therapy. The question is, who do we give what, and does it just strictly depend on physician comfort with which procedure he's doing or patient's ability to pay for the procedures? There's a lot of factors here. I found it interesting that they did the BMAC in patients less than 50 years old. That might be just because of the amount of tissue that they could capture in younger patients from the bone marrow. And additionally, if you're interested in regenerative medicine, follow me on YouTube as well as the podcast, the Pain Exam Podcast, because I am joining a group of other well-known physicians led by Christopher Robinson, who is an innovator and a researcher in regenerative medicine. We are calling for papers and publications. There will be a link on the show notes as well as on my LinkedIn. So make sure that you subscribe or follow us. If you are studying for the pain boards, go to nrappain.org and sign up so you could be part of the chat room regarding the community. We have information regarding keywords that were asked on the boards and really important stuff. Anyway, if you're a patient looking for relief of your pain, come find me in Brooklyn, 718-436-7246, and hopefully I'll be able to help you, or aabppain.org, aabppain.com. Thank you, and take care.
Dr. Rosenblum is here solely to educate, and you are solely responsible for all your decisions and actions in response to any information contained herein. These podcasts are not intended as a substitute for the medical advice of a physician to a particular patient or specific ailment. You should regularly consult a physician in matters relating to yours or another's health. You understand that this podcast is not intended as a substitute for consultation with a licensed medical professional. Copyright 2017, David Rosenblum, all rights reserved. No part of this publication may be reproduced, stored in a retrieval system, or transmitted in any form or by any means, electronic, mechanical, recording, or otherwise, without the prior written permission of the author.